Good morning, Dr. Alan Christensen here with you. I've got an update for Tuesday, March 17th on the COVID-19 situation. Now, for a bigger overview, please look back at our prior blog post, prior video. I'll mention a couple of basics really briefly, but mostly this will be information that's come out since those others. So quick recap, what is this? Coronavirus. This is a large family of viruses that includes many ones that are more common. About a third of those that make up the common cold come from this. In November 2019, a new variant of this jumped species and started to affect humans. Now, this seems to have come from Wuhan, China, and primarily live animal markets. Basically, bats, humans, pigs, and civets, which are cats used for food, were in proximity in these markets, and a lot of slaughter taking place, a lot of mixed fluids, a lot of mixed species as well. And organisms had the chance to mutate and jump species. Now, it turns out that bats share an ACE2 receptor, an angiotensin enzyme type 2, which is similar to that of humans. And this is also relevant for immune response and recognition for infectious agents. So that's how the transmission occurred. So what are our current projections? We've learned a lot in the last few days. Our models have changed very greatly. This will not likely be something like the 1918 Spanish flu, which was quite severe globally. The best approximation is this will be more like the 1957 avian influenza pandemic. It could be to that level. So I'm 51 years old. This could be the worst thing that's happened as far as an pandemic in my lifetime. Now, of some of the current credible models that exist, some argue more negative scenarios of roughly half of the United States population being infected in the coming year. So the question now is not so much how many will be involved, but how quickly it happens. And many of the measures that are being taken will not prevent infection, but will slow the wave and make it more gradual. The advantage of that is there will be less immediate demand upon the healthcare system. And the main complications requiring hospitalization, respiratory support, ventilators specifically, those things are limited. You know, how many hospital beds we have per capita, how many ventilators we have per region. So if this is more gradual and protracted, that'll make it easier because we can use medical resources for more people. The higher number of deaths we've seen in China have come because medical resources have been overwhelmed. And many who have needed medical care have not been able to access it because the demand has been so great. In terms of projections, some of the negative credible models also say we could see 1.5 million American deaths in the following year and the year after that, so cumulatively. So this could be quite significant. The thought is that we are now in the first wave in America, and likely this will progress quite a bit and run its course in the coming weeks and months. And we will likely see a second wave after we restrict some of our isolation activities. And after that, the thought is that this will be something that is in the family of ongoing seasonal infections. To some extent, it can be present non-seasonally, but it can also have some seasonal spikes, most typically worse in the winter in the northern hemisphere, worse in the summer, in our summer in the southern hemisphere, and then alternating back and forth. Some things we now know, this organism has a lipid membrane that makes it pretty fragile. So the extent to which it can live outside of a host is probably much lower than we thought in the past. Not likely much more than many hours, perhaps days, but this wouldn't be something that you would get by getting a packaged product that came from across the world, from an endemic area. It wouldn't live that long outside of a host. Some things that have also changed. We do know that it could possibly take as long as 2 weeks for symptoms to emerge. That's pretty unlikely. Most people will have symptoms in the first several days, it's thought. So 2 weeks is a safe time frame, but most plausible is the first several days. The first symptoms to show up are going to be fever, cough, shortness of breath. Not uncommon to see muscle pain, headaches, sore throat, diarrhea. And some other thoughts that were present earlier was that deaths were only in certain age groups. Now, deaths are much more common in certain age groups, especially 50 and over, 60 and over, 70 over, and 80 and over. Each of those steps, they go up pretty dramatically. But they've occurred really in all age groups. Another thought is that early along, it was thought that you could reinfect rather easily. One could have it, be cleared of it, and get it back again. We now know that those reports came from people being tested after they were ill and having false negative test results. So the test said they were cured when they were not cured. Emerging data is that if you do have immunity to it from being exposed, you likely will retain that immunity. And in terms of passive immunity or vaccination immunity, this is not likely to be something like a seasonal flu to where it's different each year. If you do have this and you have a milder version, you get immunity, that likely will be lasting. And the same thing will be true for the vaccination. We expect that it will last perhaps for 5 years or greater, but not require an ongoing update. So what do? Well, really isolation is the biggest single factor, avoiding any interaction you reasonably can. And I want to put this out there. There's a real paradox because our overall stress load, our immune system ties to our stress response, right? And our stress response is worsened when we're in isolation. So we do need to stay away and reduce the exposure we can, but at the same time, we can't become hermits and expect to be healthy or expect to thrive. So as much as you can, engage in real-time communication with loved ones. Those that are with you in isolation, that's great. Those that are not with you, reach out and call your mom, call your sister, call your friends, more so than you would. There's good data that the more we connect, the better our immune systems work. And yet, this doesn't seem to translate that much into text-based communication. So social media, email, doesn't quite seem to do the thing the same way. It really does require real-time interactions. So if you can do video chat, FaceTime, Skype, things along those lines, probably even more effective, but definitely real-time communication is important. Let's think too about your food. So with that, we've heard a lot about certain nutrients being important. Vitamin D has gotten a lot of press. We do need vitamin D. That is critical. However, the data has always been that those who are vitamin D sufficient have a better immune response than those who are vitamin D deficient. It's not that vitamin D is a miracle grow for your immune system. It's that the lack of it hurts your immune system. And like often is the case, any preponderance of it above a healthy, sufficient threshold can be harmful to your immune system. So excessive amounts are not productive. Those who are on the Daily Reset Pack, I would not encourage you to take additional vitamin D. It has 2,000 units built in intentionally. And if your doctor does say you're someone who needs more, that can happen. Please do follow that. But otherwise, I would not exceed the amount in good basic supplementation such as that. And think through in terms of food also, having some supplies on hand. Have a couple weeks worth at the ready. We're thinking a lot in 2-week blocks, 2-week intervals for planning because things will change rapidly. Foods to favor, really those that have a lot of prebiotic properties may have the best things to add. And I've talked a lot about resistant starch. So we've got the legumes, potatoes. There's versions of that are supplemental, RS Complete, the Daily Reset Shake. The shake is handy because it's a full meal, it's non-perishable, and it's an easy thing to have on hand. Other items to encourage in your diet, culinary spices. Boy, we're doing a lot of garlic and ginger and turmeric nowadays. I love to keep those things frozen and then just take them out and either use a micro planer or just mince them up after a little thawing. And they've got a long shelf life that way. So great to add to most everything. Also onions, lots of good fructooligosaccharides, lots of good sulfur compounds, and mushrooms are phenomenal as well. All types. The plain old white cap ones you get in the grocery store have a lot of immune benefit. I also love getting the dried shiitakes. They are often quite cost effective and have got a really long shelf life, and they taste great. They're easy to work with. Another food you don't think about a lot as an immune tonic is good old oats. Beta glucans in oats, large amounts of benefit. So yeah, steel cut oats, old-fashioned rolled oats, all types can work really well that way. So things to avoid. Well, top on that list, probably alcohol right now. Lots of data on it depressing generalized immune responses. I would avoid CBD products, cannabidiol products and their derivatives. There's pretty good data arguing that they lessen the kind of immune response that you want for making yourself more resistant against viruses. I've heard many ask about colloidal silver. I would strongly avoid it. It can be an antimicrobial. It's also very toxic. It can stain your skin blue. And broad spectrum antimicrobials have more harm than they have benefit. They can be good for some types of bacterial infections, but that's not what this is. And taken outside of an infection, they only make your body less resistant. I would say the same thing about some of the antimicrobial herbs like golden seal, also known as hydrascus. I also do not recommend probiotics as far as just general measures for times like right now. The data on them helping is quite mixed, and quite a bit suggests that they can be negative. One exception could be Saccharomyces boulardii. That's a yeast-based probiotic, which is significantly different in its effects upon the immune system. And along with having a good supply of food, think about water, a couple weeks of water, having that on hand, and planning to consume at least about half an ounce per pound of body weight per day. For me, that's going to be at least about 80 ounces, 80, 90 ounces, so 3 or more quarts. When you're physically active, that can be closer to an ounce per pound of body weight per day. And that's a critical thing. Probably the biggest single thing to do to really help your immune system is get some extra sleep. Whatever you do most of the time, tag an extra hour on top of that right now. And do that by more so going to bed earlier. The hardest thing to change is your wake up time. Keep that where it is, but go to bed an hour earlier right now. That'll do a wonder of good for your immune system. If you've got the time for that, take a nap midday as well. But sleep is one of the biggest, most powerful variables on helping your body be more immune. Next up would be exercise. Now, the trick about this is you do want to add onto it. You do want to get to a healthy amount, but not overnight. If you add on too fast, you will weaken your immunity and strain your body. So tag on not more than about 10% of what you did last week, but tag it on. Just easy numbers. Let's say you exercised for 200 minutes last week, which would be about 6 into that. So about a half hour a day, somewhere around there. So shoot for 220 minutes this coming week and escalate till you're working up to 45, 60 minutes a day for most days. So gently work that up, but not radically. You don't want to strain yourself. And the more that you can do that outside in the sunlight, the better. And outdoors, at home. I would be cautious about gyms, obviously. Now, the other thing to think about is that when you're not isolated, isolate when you can. When you can't, if you've got to go get gas, pick up some more groceries, if you are working directly from a work location, then you do want to really keep your 6-foot proximity. That's about how far you could reach someone else's hand when they reach theirs out. And in terms of greetings, here's the new norm. Air handshakes and air hugs. That's what you do. We're not touching, we're doing air shakes and air hugs. And think about when you're out and about, have some disposable gloves available for when you do go pick things up in stores or you do go fill your gas tank. And I've been using these already because there's times where you cannot avoid touching surfaces that others are touching. And there's things that you can't always sterilize all those surfaces, but wear some gloves when you're there. And the important thing is know how to safely remove them because you don't want to touch the surface. So I just put these on and I'll show you all. So you will reach inside here and just hook the bottom. You'll come up, see? And now I'm going to reach inside this glove. I'm going to keep that glove inside the other and I'll come up. And so this is all inside. I've never touched the outside of any of those gloves and now they can be thrown away. And hand washing is still great afterward, but in proper use of gloves and proper disposal, I never had to transmit anything from outside of them to my skin at all. And we still think the biggest transmission is by contact. So this is important. If you do need to pick some things up to get some groceries or whatnot, think a lot about delivery or perhaps even better yet, pickup services. We've got services like Instacart, we have Prime Now, and in many cases, you can order for pickup. You go to the store, you park in the parking lot, they come out to you, they talk to you on your cell phone, you pop your trunk, they load up your trunk, they close your trunk, you drive home. So you're not actually having to interact directly with someone. And you can even let those things, assuming that you have non-perishables, they can even sit for the course of overnight and make the likelihood of them containing infection quite minimal, or just handle them cautiously using good hand washing techniques. But pickup could be a lot better than shopping. Now, what if you've got some symptoms? What if something's happening and you're not quite sure what's going on? Well, a couple categories. They could be mild symptoms, a more significant situation, or you may not be sure. If you are not sure, telemedicine is an option. We are active with this at Integrative Health. We are doing exclusively telemedicine now through the end of March. And our doctors are available. They can help out. And they can help sort out symptoms you may have that could be possibly respiratory symptoms. They can assist with that. Mild symptoms can often be managed pretty well with home care. That's going to be more so, typical cold flu-like symptoms in general. Fever, cough, diarrhea, body aches, runny nose. Now, in those cases, you want to quarantine yourself. You want to wear a mask if you're sick, if you're sharing a room with someone, or if you're sharing a car with someone. And by and large, rest and fluids and some of those healthy eating guidelines are the main things you want to go with. A trick is that you do want to move. Some of the complications come from the respiratory system. Those can be worse when you're completely immobilized. So even if you are at bed rest from an upper respiratory infection, move around for at least 5 minutes per hour. And that can be just some light walking. You can have a device to step on top of, like a bench or a chair. You've got a treadmill, that's great. But give yourself about 5 minutes of walking at least every hour to keep your fluids moving properly. Now, this is more severe if you're an at-risk population, and we would call that over 65, someone with chronic disease, such as hyperthyroidism, so untreated Graves' disease or overdosed thyroid disease. That could be just, taking too much or making too much. Cancer, heart disease, diabetes. This last one, obesity, has been shown to be a risk factor, so that can also escalate the significance of this. We also think about it being more significant with red flag symptoms, and that can be chest pain, confusion, shortness of breath. Now, if you're at an at-risk population, you should be medically evaluated and possibly hospitalized. If you have red flag symptoms like the chest pain, the confusion, the bad shortness of breath, you should call 911. If you are seeking out medical care, you want to call the center first and have them be expecting you when you're seeing them in person. And start with your nearest emergency room, confirm they have availability and space for you, and confirm the nature of your symptoms. Let them know when to expect you. So that's what we got for today. I want to just point out one more thing too. So the thought about there being special risks for those with autoimmune thyroid disease, that has not panned out. Now, autoimmunity, those who are on immune suppressants, biologic medications, prednisone, things along those lines, that's more common with arthritises, autoimmune arthritises, or lupus, connective tissue disorders, but those are not the things used for thyroid disease. So with the exception of those who are over-medicated or those who have untreated hyperthyroidism, we don't think the population with thyroid disease has any special risks. But this is a big thing. We're working hard to stay on top of this, keep you safe. If you are due for medical testing to update your thyroid levels, please hold tight. Don't go do that right now. In the coming week, we should have some home testing options available for you to where you can test in the safety of your own home and not need to be out in the community to do that. So I'll see you back real soon. I'm going to do my best to keep you all safe and healthy and keep you updated. All right, take great care. Bye-bye.